because there's definitely, I would say most of my clients, when I mention the possibility of putting their dog on an anti-anxiety medication such as Prozac or some other medication, I'm met with either resistance or you know, a healthy dose of why do you want to do that? And I completely respect that. I realize that drugs are not a quick fix, and I think it's important for owners to realize that too. I suppose on the flip side, occasionally, not real often, but occasionally I'll be like, can't you just put them on some drugs and just, you know, just knock them out or whatever. And so I tell people that there's no substitute for behavior modification. However, anti-anxiety medication, when paired with behavior modification, combined have a better result than either one alone. And I think that's where it's valuable. I feel, and you talk to anyone, like I said, I've confessed to you, I'm not a high anxiety person, but you know, I know people who are, and they tell me that, you know, being in that state of anxiety or panic attack, it's awful. It is horrible. And to think that your dog is going through that, it's not a good quality of life in some situations. So I feel it's more humane to put a dog on an anti-anxiety medication, even if it's something like a short-acting anti-anxiety medication, alprazolam. A lot of people, go to the next slide, you know, think about the state of mind that this dog must have been in to cause that. That is not a good state of mind. And you've all seen pictures on the internet and everything too, and even probably some of your clients, that, you know, it's just awful. So I feel it's much more humane, and I've even, I used to be more hesitant in recommending drugs because, you know, people don't want to put their dogs on drugs for behavior. But I have really found that it, you know, as an example of a dog who's anxious about coming into the veterinary office, you know, if I can prescribe some alprazolam is Xanax, and have them give that.
We get an update on line 2 for Jesse White. An update on line 2 for Jesse White.
I feel that that's, you know, if I can help them have a better experience coming to, well, that's a good idea. Just remind me to put it back. I didn't even do that. Okay, well, that's good then. You know, a dog or cat who's anxious about coming to the veterinary office, like the owner just dreads bringing their dog in because he just freaks out in the veterinary office. Let me prescribe him some alprazolam prior to his next visit, so that experience is a little better for him. And well, let me just go into the whole neuroanatomy of fear. This is kind of not a very good picture, but there are physiologic changes that occur when the brain is experiencing fear. These limbic areas of the brain involved in anxiety. And this is where I hope I don't just totally bore you, but in the brain, when there is so this is a neuron sending a message to the other neuron, and this is where, you know, those little dendrites, the little, you know, where they meet, and this little close-up of that. So this is, you know, where it's normal. Basically, a neuron is going to release, you know, one end is going to release neurotransmitter to the other side. There are lots of different kinds of neurotransmitters. The most common, there are neurotransmitters that kind of help wake up the brain, and there are neurotransmitters that kind of help the brain kind of either go to sleep or relax a little bit, and then other neurotransmitters that do other things. So in this example, I've got glutamate. Glutamate is a neurotransmitter that helps wake up the brain, and so certainly in a state of hyperarousal or fear, there's a lot of glutamate. The body is like, you know, fight or flight, you know, in that mode. So here there's just a little bit of glutamate, and then in a situation where there's too much arousal or fear, you know, then that can lead to panic attacks. If there's too much, and it's really so on a neurochemical level, there is too much neurotransmitter. And so, one reason I'm not a big fan of acepromazine is that it has no effect on anxiety. Yeah, it makes them sleepy. They're just sleepy and freaked out. And acepromazine, I'm sure it's still prescribed way too much, although I hope it's less than it used to be. But it used to be the go-to medication for thunderstorm phobias was acepromazine, which, when you look at it, how it works, it just makes them sleepy. But and in some cases, you know, they have can have a paradoxical effect and just be, you know, really freaked out. So I do not recommend acepromazine for anxiety. I have a few situations, you know, very case dependent, where I might need to prescribe it in a behavior case because the dog is going to hurt himself. You know, the separation anxiety dog, where they can't put the dog in daycare, they can't stay home with it all day. He is hurting himself trying to get out of his crate, or he's destroying, you know, the house, and just he needs to sleep while the owners are gone. I'll combine that with an anti-anxiety medication, but acepromazine by itself is not appropriate for anxious dogs.